AH-600 ultrasonic scalpel system is indicated in general surgery, gynecology, urology, thoracic, pediatrics, ENT, plastic, other open and endoscopic procedures to cut and coagulate soft tissue when hemostasis is desired with a minimal thermal injury. It can handle multiple surgical jobs with precision, including grasping, dissection, transection, cutting, and coagulation. Assembly. Inspect the package and expiration date before opening. Using aseptic technique, remove the scalpel from the package. Push the rear end of the scalpel until the maximal opening of the jaw. Pull and unlatch the hatch. Insert the rear end of scalpel into the opening of the handle. Close and latch the hatch. Slightly move the hatch to ensure it is locked safely. Take off the protective cover of the transducer before connecting the scalpel. While holding the scalpel vertically, insert the transducer into rear end of the scalpel by rotating the scalpel clockwise until it is tight. Slide torque wrench onto the shaft. Turn the torque wrench clockwise while holding only transducer until hearing 2 clicks. Close the trigger and remove the torque wrench. The transducer is now connected to the scalpel. Note: please close the trigger while sliding the torque wrench onto or off of the shaft to avoid any damage to the blade and clamp arm. Connect the scalpel and transducer to the generator. Make sure the arrow symbol is aligned. Attach the foot switch connector to the foot switch socket on the generator. Make sure the arrow symbol is aligned. Connect the power cord to the generator and to the grounded electrical outlet. After the completion of assembly, turn on the generator. The generator will be conducted in self-test. Do not turn the generator power on before the scalpel, transducer, and foot switch are connected to the generator. Output power can be selected from power level 1 to 5. The maximum power level setting is always 5. The minimum power level can be selected from 1 to 4. The system defaults to min power level 3. When this power level is activated, the audio feedback is initiated and corresponding level running on screen. For greater cutting speed, use higher generator power level. For greater coagulation, use lower generator power level. Manual control and foot control can be selected on home screen. The green indicator means the manual control or foot control is effective. Adjust the volume to the proper size. Note: during testing, keep the scalpel jaw opened and empty excitation time should be within 2 seconds. Test foot switch. Left pedal, yellow, is equivalent to the max button of the handle, and right pedal, blue, is equivalent to the min button of the handle. Scalpel tip cleaning. The forceps holder should be cleaned periodically and as necessary throughout the procedure. By activating the scalpel tip in saline, or it can be wiped with the sterile gauze. Note: 1. The blade shall be protected from metal while activated. 2. Optimum performance is achieved when hold the tissue at the site of the 2/3 of the scalpel tip during the use of the ultrasonic scalpel to cut the tissue. Try to avoid cutting with overloaded tissue or without tissue in the jaw. 3. If audible high-pitched ringing and the touchscreen displays an alert message, please check the cutter or transducer. Please reattach the scalpel or transducer properly or replace it with a new one. Disassembly. Turn off the generator, then unplug the foot switch and transducer. Disassemble the transducer. Close the clamp arm and slide the torque wrench onto the shaft. Hold the transducer vertically. Turn the torque wrench counterclockwise until the transducer is separated from the scalpel. Note: place the protective cover back on to protect the transducer. Disassemble the scalpel. Unlatch and open the hatch. Separate the scalpel from the handle. The handle is reused. Please keep the handle locked before sterilization. Dispose the scalpel in the appropriate container.